Now, even as government shows optimism over the COVID-19 situation, there is a source of worry for officials of the Nsawam medium security prisons. They fear a positive case at the facility will spell doom as they struggle to practice social distancing due to overcrowding there. Public Relations Officer of the Nsawam prisons, DSP Ademo Abdul Latif, tells JoyNews prison facilities in the eastern region have only been given 20 thermometer guns to share among themselves, a situation he believes could militate against their efforts in the fight against COVID-19. He spoke to JoyNews' Kwesi Parker-Wilson.
The issue of social distancing is really a very difficult issue in prisons, especially in the medium security prison in Nsawam, because as of today, we have over 3,000 inmates in our custody, as against the original capacity of about 800. So you can guess the rate of overcrowding in the facility. So talking about social distancing, I would say it's close to impossible here. It's close to impossible? Yeah, it's close to impossible in the prison here. So the only form of... their lives, they are not. They are not. That is why we have decided to put in place all mechanisms to make sure that the virus, we don't record a case here. So clearly when you came, you can see the measures we have put in place. We have medical personnel outside who check your temperature, will ask you of your traveling history, etc., etc., just to make sure you don't meet the case definition before you are given access to the facility. And God being so good, these measures we have put in place has helped to the extent that as we speak, we have not recorded any case of COVID-19 in the prisons.
I see. But with the kits for thermometer guns and all that, are we sufficient enough to check the inmates and those who come in?
Yes, we have some amounts of thermometer guns and other kits, but they cannot be sufficient. They are not sufficient. I granted interview earlier on, and I mentioned to them that we have about 20 thermometer guns. But the 20 thermometer guns is not for only in Nsawam, it's for the whole region. For the whole region? Yes, we have other prisons. Koforidia is there. So clearly it tells you that it's not enough. It tells you it's not enough. So it is against this background that we are calling on the civil society, organizations and other philanthropic individuals to come to our aid. To come to our aid in assisting us to get some of these items, like thermometer guns, hand washing soaps, hand sanitizers, Veronica buckets, etc., etc., so that we can make sure with these things that the virus actually doesn't get into the prison, because when it does, the consequences will be very, very...
Right, and for you, would you say that would be prudent for the Ghana health officials to come and do mass testing for the inmates?
Well, it is not up to me to say that. I think it's something that our directors, together with them, will take a decision on that.
So, has a decision been taken? Let's find out. Public Relations Officer of the Ghana Prison Service, Superintendent Courage Achem, joins me with more. Sir, thank you very much for your time this afternoon. And my first question is, what is the plan to decongest the prisons? 3,000 as against 800 capacity. We're looking at 2,200 of excess here. What is the plan?
Thank you very much for having me. Let me say that, well, there have been measures to decongest our prisons, but I must say that all those measures can only bring full impact in the long term. But if you are asking for the short term, I must say that it's a bit difficult for me to come out with a measure that can quickly reduce our numbers, which are in excess of 4,000. Probably some, pardon or amnesty granted to some inmates, as the president earlier did some few months ago, a month ago, I must say. Maybe that can be.
Looks like the technology there, but we'll certainly raise him back on the line to get what the COVID-19 plan, let me put it that way, because for a cell that can take 800, that is now taking over 3,000. I even put the excess at 2,200, but he says it's about 4,000 of them. It's a very worrying situation, but I've got back the prison's spokesperson, public relations officer for the Ghana Prison Service, Karaja Chim, who joins me once again. So you were talking about the long-term efforts. Actually, I was looking at the plan in these COVID-19 times, because we know that the number of people in the cells, is just overwhelming. But there's COVID-19. Is there a plan at this point as to how to deal with this situation?
Thank you very much. Thank you very much. There is a plan to deal with or manage the situation in our prisons within the context of COVID-19. But those plans are not meant to decongest the prisons. But as you may be aware, the prison administration, right from the word go, put in place some measures, first and foremost, to ensure that we do not record any cases. And then also, we would have very much wished that within this COVID period, there wouldn't be any of our members of society going into crime and therefore finding themselves in prison. But unfortunately, that is not the case, and therefore we continue to receive new admissions. And therefore the prisons administration, in conjunction with key stakeholders within the criminal justice system, has designated some 7 key selected prisons for the admission of fresh inmates, just so that we do not stand the risk, or at least we minimize the risk of contaminating the larger inmate population.
Okay, so you have designated 7 prisons for admission of inmates who test positive for coronavirus?
Not for those who test for positive for coronavirus, for all fresh admissions right from the court.
Okay, so which are these?
And so the prisons across the country have been zoned into 7. If you permit me, I may like to mention the zones to you.
Yeah.
We have the Southern Zone 1, which is made up of Eastern, Greater Accra and Central regions. Southern Zone 2, made up of Western of regions. Middle Zone 1, made up of Ahafo, Bono East regions. Middle Zone 2, made up of Ashanti region. And then the Volta Zone, made up of Volta and Oti regions. Northern Zone 1, made up of Northern, Northeast, Savannah, Upper East regions, and Northern Zone 2, made up of Upper East region. And so these are the zones that have designated prisons purposely meant within this period for fresh admissions.
Okay, so these zones, if you can break it down for us further,
okay.
What are they, and where are they, if I may ask?
They are in the various regions. At the moment, I would prefer not to mention out the specific prisons designated within these zones, but they are known to our colleagues within the justice system.
Okay.
We have the criminal justice administration system, the police are aware, the judiciary are aware, and should anybody be brought to any or admitted in any prison custody, and the family members whom the person himself agrees to be informed will be appropriately informed.
Okay, let's talk about Ashaiman. For example, today, Ashaiman not today, actually, I think last week, Ashaiman recorded 9 cases. They took some samples and did the test. 9 of them have confirmed positive, 1 in Bong. For prisons, I mean, for cells like that, is there also a plan? Is that part of your plan?
Thank you. Let me say that Ashama, as it were, we do not have any prison facility there. And so if you're talking of any inmates around Ashama or within Ashama, then you might probably be talking of a police cells.
Right.
And therefore, I think that the police will be in a better position to speak to that.
Right. I get you. So far, none of your prison inmates have tested positive.
Thank you very much. Unfortunately, we would have wished that to be the case, but unfortunately, no. We have 1 case recorded in the central region, specifically in the Ankafo Maximum Security Prison. It was an inmate that was recently brought. There was a little bit of miscommunication, and therefore there was a test conducted by the, that was supervised or, at the instance of the police. But then the results were not in, and they were brought into our custody. And then a few days later, the police informed us that one of them tested positive. But as I mentioned earlier, the police administration put in place the mechanism to ensure that new admissions are, screened and then quarantined for 14 days. And so within this period, the inmate who tested positive was not added to the larger population. In fact, maximum security prison Ankafo is one of the prisons that is not congested. As we speak, it has a capacity of 2,000, and as we speak, we have less than 1,000 inmates there. And so the prison administration, right from the admission of these fresh inmates, isolated them for observation, and therefore when this came, it didn't pose much problem for us. I must say that the prison administration, together with the Central Regional COVID Task Force, is managing this inmate in our facility.
A lot of people have said it's only a matter of when and not if, as far as how widespread this infection goes. But we've been speaking to people in Sawam prisons, for example, and they're complaining about thermometers, thermometer guns that they need to at least check. It's not foolproof, but at least they can use that to check the temperature of the people that come in. They don't have it. They don't have enough. What is the plan to deal with that as well?
Yes, that is a big challenge we have. We do not have enough of the PPEs, especially the thermometer guns. And that is why the few we have, we are trying to make do with. But I must also say that it will be useful if the public-spirited individuals, corporate bodies will come to our aid and supply us with some of these PPEs.
So everybody is talking about PPEs. I don't know what the allocation to the prison service has been. Are you getting your supplies from government, or do you have to self-finance, or are you relying on donation? How are you getting PPEs?
We got a few from government through the Ministry of Health and the Ministry of Interior. But as I said, they are not enough. And then we have also gotten support from some corporate bodies, some individuals, some NGOs. But the fact remains that many of these items are also consumables. And so you bring them today, due to our sheer numbers, tomorrow it is finished. And so we keep finding ourselves in need.
So the prison service is still in need of PPEs and some of these things that
exactly so
required in these times. Well, if you're listening, perhaps you want to reach out to the prison service and help them with some of these. But sir, thank you very much. We'll be coming to you as and when it becomes necessary. Thankfully, this one person who was positive didn't get to mix up with the other inmates. But did you do any contact tracing, with the officers who may have come into contact with this person?
Yes, thank you very much. About 12 officers got into contact or were exposed during the admission process. And therefore, all these officers have been tested, and they have, at the moment, they are on self-isolation, and we are awaiting the results. And
do these self-isolations, how do they impact your ability to work? I mean, you're dealing with a huge number, so you require officers to be able to keep the people in check. With about 12 of them gone, how do you manage?
Well, it's a challenge, but as we've been trained to always improvise and be able to perform as it is, no matter the situation, the prison administration has put in place measures, and we are making do with the numbers we have, and we don't have a challenge.
I hear you, sir. Thank you very much for joining us. Superintendent Courage Achem, there is a public relations officer for the Ghana Prison Service, joining us. If you just heard what he said, some 12 officers, or 12 prison officers have been exposed and are on self-isolation. One person or one inmate was tested positive to coronavirus, but thankfully he hadn't been mixed, with the entire inmate, and so he has also been on treatment. But they need PPEs, and they're calling for help.